Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Maybe you have a new diagnosis you want to research, or you could be trying to make sense of some troubling symptoms, or you want to understand a pathology report of a recent biopsy. There are lots of ways people are seeking medical advice and information from chatbots. But is this a good idea? I'll talk about that with Dr. Bardia Rodd. He's an associate professor of pathology at Upstate and also the associate director of AI innovation at the SUNY Upstate AHEAD Center. Welcome to The Informed Patient, Dr. Rodd.
Thank you, Amber. It is great to be here.
Before we get into chatbots, can I have you explain for us what the AHEAD Center is?
Yes, the Upstate AI Center, what we call it as AHEAD Center, is a center that we established in 2024 in recognition of the growing importance of artificial intelligence in advancing healthcare and biomedical research at SUNY Upstate. We launched the center to complement and accelerate AI's clinical and research and education missions.
Now, you have a doctorate in electrical and also in computer engineering. How did you get involved in medicine?
That's a very good question. I was always been interested in intersection of medicine and technology and how AI can improve healthcare. Throughout my education and research career, I work in artificial intelligence and data analytics with many different projects that focus on medical application. One of our work maybe it dated on like 2 decades ago. My involvement with medicine became more significant after completing my second PhD. Then I joined the Department of Radiology at University of Pennsylvania Parliament School of Medicine. There I worked on AI-driven models to predict outcome for non-small cell lung cancer. And then later on, I joined biocomputational engineering program at the University of Maryland at College Park, when we helped establishing one of the first programs of this kind in the United States, the connecting biology and medicine with engineering in undergrad level. And we have close collaboration with the School of Medicine in Baltimore.
Interesting. So let me ask you to describe for us what artificial intelligence is. What is AI?
Yeah, sure. Artificial intelligence, what we call it as AI, is the ability of the computers to perform tasks that typically being used by human intelligence. We replace the human intelligence in terms of repetitive tasks or the tasks such as recognizing patterns or learning a specific data or making prediction and supporting decision making. This overall, all of these is defined as AI.
Where in your training did you first learn about AI? And I'm wondering what you thought of its potential when you first heard about it.
In the computer science, when I was first introduced to AI during my education in engineering and computer science studies. In many ways, the fundamental of engineering and computer science are deeply connected to AI, data processing, pattern recognition, problem solving, and all of these. So what is fascinating me, and it is generally fascinating, is the ability of the computers to learn from the data and assist in the complex challenges. And I saw the tremendous potential of the AI in the medicine. As you can see nowadays, it's not necessary for a medicine, it's all over our daily life.
Has AI evolved the way that you thought it would, or has it happened more quickly than you expected?
Yes, largely. I always believe that AI could be a powerful tool to analyzing complex tasks or supporting different aspects of our life, particularly in medicine. But what surprised me totally is the speed of progress, and especially the deep learning and generative AI nowadays, by having many capabilities, it got really accelerated more than what I was expecting.
Can you tell us generally how chatbots work? And are chatbots, by definition, are they AI?
Well, we can say that, yes, a chatbot works for learning patterns from the vast amounts of text and then predicting the most appropriate response based on the user question. So rather than searching from the stored answer, which was a previous system that we used to call it as an automated system, it generates response dynamically based on the context. And more importantly, in the healthcare, it allows AI to help summarizing information, draft the documentation and the supporting knowledge retrieval, but it still requires human oversight because it reasons for patterns rather than a true medical understanding or clinical approaches.
So I was going to ask you if chatbots can be trusted, but if they still need human oversight, it sounds like not entirely they can't be trusted.
Yeah, I mean, like AI chatbots can be trusted for many tasks, but not blindly. In medicine, it should be viewed as a powerful assistant that augment clinician, not replacing clinical judgment. And basically what AI or chatbot does, it summarize the information and make it more tangible for us to understand, but we cannot trust it 100% because we definitely need clinical judgment, a doctor or professionals to come say the last word.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Associate Director of AI Innovation at the SUNY Upstate AHEAD Center, Dr. Bardia Rodd. Now, I've heard the term hallucinate, and I guess that means making things up or not totally understanding something. How often does that happen?
But the frequency of hallucination depends on the model that we are using and the question that we ask and the overall domain. But while modern AI systems are more accurate than earlier version, they can still generate convincing but incorrect information, which is why we need to have a verification. Human oversight remain an essential factor, especially in healthcare.
So, which are the chatbots that are ready for prime time, that are being used and somewhat reliably? I've heard of ChatGPT, but there are others, right?
Yeah, there is no single best medical chatbot, we can say. Most general purpose AI system, like what we know it as LLMs, are designed for information, giving information and basic education, and definitely not for medical decision. For the safe using, we should always use reputable medical resources to verify, like WHO, NIH, and to be cautioned of using chatbots that they provide definite diagnosis or treatment, and what is preferred to be updated systems, like whatever we check, we need to check because most of these are not really updated. And chatbots also cannot be used as a standalone. It needs to be always verified with the healthcare professional. And that being mentioned, I wouldn't really trust 100% on any chatbots, including those that you mentioned, like ChatGPT or Claude or so many others. But these are only for general understanding what are the symptoms and just general understanding about the problem rather than knowing the diagnostic or treatment answers.
I wanted to ask you about how current they are, particularly in medicine, where there are advances and new information available. You'd want to make sure that, the chatbot was up to date. So let me ask, can chatbots differentiate fact from opinion or speculation?
Well, it's a very great question in a sense that they can be helpful for generating a possible explanation, as we discussed, but they are not reliable for medical interpretation as for the symptoms, for example. In a practice, they may suggest a wide range of possibilities from benign to the serious without being able to properly evaluate clinical context. So their output should never be treated as the diagnosis for certain. And the speculation is indeed a part of that, unfortunately.
So if they get better based on their work and what they're doing, have you seen people try to kind of game the chatbot by giving it false information and teaching it incorrectly, and then it's learning, you know?
Yeah, that's absolutely true. It always happens. It depends on the prompt that you're using and the information that you're giving. The response would be towards the pleasing the user rather than facts to be mentioned.
Are they free to use at this point?
Yeah, many basic AI tools are free, or often free versions are available, but more advanced capabilities or higher accuracy, or even sometimes I cannot specify exactly, but some medical grade system for explanations are often paid and required institutional access. And it's going to be more and more subscribed rather than being free version. If you realize nowadays, even ChatGPT for a general purpose application is getting more and more towards the subscription and paid access rather than the free version.
Do you have any advice for how people can use a chatbot to get credible health information and medical advice? Is this safe for the consumer to do?
Yes, to use a chatbot, especially related to the healthcare safely, we better use them for education, not diagnosis or prognosis. Verify the information with the trusted sources like NIH, WHO, a healthcare professional would be the best. Avoid sharing sensitive information or personal information to the chatbot, and view the response as the guidance, not necessarily having a medical advice. And in overall, be cautious of overall confidence of the answer, recognizing the medical uncertainty in all the response that you're going to get. And at the end of the day, despite the fact this is a great tool to be used, but it is always great to have that as a general information and have this information verified with our own doctors.
So, do you think that people can expect to get an accurate definition of a medical term from a chatbot?
Um, yes, chatbots are generally quite good at providing accurate, simplified definition of common medical terms, especially well-established concepts. However, more complex, evolving, or high technical terms is still best to double-check with the trusted medical references.
Are chatbots good at providing ideas of what certain symptoms could mean?
They could be helpful for generating possible explanation, but they are not really reliable on medical interpretation of the symptoms. As we discussed, it can give you a very broad opinion about any type of illnesses, but it can never point out the exact uh, problem, considering the complex scenario evolving with each patient.
Can they read and interpret a pathology report accurately?
Yes, they often summarize and explain the language in the pathology report, but they're not really reliable in a sense that to be able to interpret the clinical sense of the information given. And it is an important factor that some important factors like tumor grading or margins in the pathology report or clinical implementations and some information like that still needs to be referred to a pathologist and the actual professional to be the last judge of the outcome.
Is there anything people should not turn to a chatbot for, medically speaking?
Yes, several important things that people should never use a chat, or especially in the medicine. It should not be used for diagnosis. It should not be used for prognosis, or what we call it as treatment decision. And medication changes. It can never be used for the medication changes, emergency triage, or interpreting urgent symptoms. They cannot be used for these cases. And the reason is that they may be inaccurate or overconfident providing the information that it just generated through the hallucination.
So don't turn to it if you're wondering whether you need to go to the hospital emergency room and
Absolutely.
okay.
Absolutely. Yeah.
Now, you touched on this a little bit. Do the chatbots store a search history?
Yes, indeed, it does. Many of the chatbot services are made based on storing the conversation, what we call it as chat history, but how the data is going to be handled depend on the platform. Different platforms, they have different policy. The best thing to be cautious about that, to check each platform's privacy policy to understand how this information is being stored or being used, or if they are protected or not.
So some of them may have some privacy protections and some of them may not.
Exactly, yes. They may not, and it's more towards they do not have that privacy protection rather than they do.
Do you think that chatbots could serve as health coaches for people if, maybe they're trying to lose weight? And can the chatbot help with that?
Yes, chatbot can serve as basic health coaches, especially as you mentioned, like a general wellness support, like a diet, weight loss, or exercise habits, or medication reminders and behavioral tracking. But they are best viewed as what we call it as supplementary coaches, since they lack clinical judgment and they cannot monitor the real healthcare changes directly from the patient, and it may miss important medical risk without human oversight. And that is the reason we consider them as supplementary coaches rather than being an ultimate coach.
Do you think that chatbots would fill the gap for people who don't have any health insurance or can't access a provider for any number of reasons? Could chatbots fill the gap?
Overall, chatbots are very helpful for the cases that they can provide the general information in a sense that people, they can use them for well-defined, low-risk structural healthcare tasks rather than direct clinical decision-making for the cases that they are very complicated. They need the actual medical assistance rather than just a general, well-established information. At the end of the day, the complex clinical judgment and handling high-risk scenarios require human expertise and more like physicians and clinicians rather than a system.
Now, we've talked about how regular people are using chatbots. How are the medical providers using them?
In the most current setting, the physician do not routinely using those, but if they are using those, medical professions, they use it as a summary of a task or a summary of the report, or using it in a very general setting rather than using the system as the ultimate outcome. These tools are being used for the tasks that they are tedious and there are a lot of information needs to be digested or summarized and then being used. These are very helpful for saving time for the medical professions, but it can never go towards the scenario that replace those doctors. So the physicians and many other health professionals, they are using it in the general, in the baseline approaches, but they cannot use it for the actual, diagnosis or more complex clinical judgments.
So it may speed up some tasks, but their oversight is still 100%, it sounds like.
Yeah, we would say that the best task is that in the clinical setting, clinicians and physicians are responsible rather than having a chatbot to help them. However, we have had some efforts for having internally defined those chatbots, but it's still in the process and is not something concrete that we can highlight now.
What are the risks in using chatbots to help with patient care?
Well, the key risks are including inaccurate or misleading information, which we often know due to the hallucination, and overly confident response when they are wrong, or the lack of clinical context, which can lead to an unsafe suggestion. They are also concerns about privacy, over reliance by users, sometimes even clinicians, and variability in quality, especially when the systems are not clinically validated. There'll be a large variability in the outcome, which is not in the benefit of patients and people that are seeking help in terms of the healthcare.
You're listening to Upstate's The Informed Patient podcast with your host, Amber Smith. My guest is Associate Director of AI Innovation at the SUNY Upstate AHEAD Center, Dr. Bardia Rodd. Do physicians document their use of a chatbot in the patient record, or would a patient know that a chatbot was involved in some way?
In most of the current cases, the physician do not routinely, document chatbot use in the patient record, especially when it is even in the background tool, like drafting a note or summarizing information. However, looking at the general trend of AI and advancement, there is a growing discussions about they may need to disclose or document it in the certain cases. And right now, practice varies widely based on the standard of care rather than having those involved, but I can see that it is underway and it is coming.
So if a chatbot makes a big mistake, I understand it would be sort of on the physician to correct it and be responsible for it. But if a regular person is doing a search through ChatGPT and they get, bad advice, who can they complain to? Is there a staff at ChatGPT that you can call and complain to?
Yeah, unfortunately, there are cases that increasingly they use AI for or chatbots for uh, different aspects. What we know right now, it's a common knowledge that there are some lawsuits against that, but there is nothing certain that you can actually reach out to the person you complain about it or something, because these are generally mentioned as a baseline or a fundamental of using LLMs, that they need to be used only for the general purpose and a background tool rather than being used specifically for the healthcare or specifically in the cases that there are decision making required. And it's still something they are debating on how it's going to go, but there is nothing as such for now. About privacy terms and conditions, there are some specific LLMs designed for checking, mining through all of this data and responding based on actual trained bar past, if you will, people like lawyers, and AI could help you to take care of those. And I have to say, even in our field, for now, we are using a specific AI very much directed for example, a specific tumor type, a specific cancer type. But it finally gives you a simple accuracy, which is basically meaningless. It's meaningful for me or many other clinicians that they are working in a field, but is not really tangible to understand for patients, for other health professionals that they are working in a different field. So one of my colleagues, and it is actually being done in Mayo Clinic, already integrated AI with the actual image guided system that we develop, and it's fairly complicated compared to what we have it for ChatGPT and similar. But they add this LLM component to be on the top of this very tedious, complex task to translate, communicate in a beautiful, simple language to describe that what is actually you're looking at. And this is becoming a great thing, a great source that if, for example, patient previously, and even now, we all can get our radiology image and we feed it to a system that communicate with us. We can do the same for pathology. And this is such a great thing, great tool to have this. They are using it in the closed system. So how they spread the information once they are in the open system. The systems like Cloud, ChatGPT, many other like Grok, a lot of them. So these are open system accessing to everybody for free, and it's easy to access, it's easy to manipulate, and so many other factors. However, in the systems that they are using, it's completely a closed system. It cannot be hacked. It's a complete for medical. It's like we are logged into our Outlook. We can have another component that it goes towards our health setting. We can have a communications with them, and we can get some insight about our information, because this is really secure, and it depends on how it implemented too. So there are so many factors to do that. One of them was converting the entire patient health information to a pseudo, a dummy serial number, which cannot be identifiable, and strip all the PHI information from all data, and then give it to the system and to see how it's going to be. The patient, for example, a number 002 is going to get the treatment of this based on this diagnosis and all of this, and everything needs to be and verified by a doctor. And that would be a good system that everybody can use. But unfortunately, we are way behind that, because there are so many factors. Some of these methods are related for imaging, some of them are related to oncology, or depends on the problem, obviously. And we need a specific AI for all of those, and then we integrate them all in one system. That's what my team is doing.
You've got your work cut out for you. What should we be looking forward to with the evolution of chatbots? What is the future going to hold?
Well, considering the evolution, we will have more specialized, clinically integrated, and the context-aware over time systems, rather than what we already have in the healthcare. The most important evolution will likely to be towards safer, validated system embedded in the clinical workflow rather than the standalone tools, and supporting clinicians with the documentation, and also decision support with the condition that it will be oversight by a clinician, and it will be always like that. It can never be replacing any physicians or any medical professional. And patient communication also will evolve in the sense that it can involve a more clinical oversight within the patient communication, rather than what we have at the current state of the system.
How do you anticipate that chatbots will be regulated, if at all?
AI chatbot will likely to be regulated by considering the risk. The reality of the computers. We thought one day that the computers are coming and they're going to solve all of our problems. They came and they generated new problems for us. And now AI is exactly the same. It is a great solution for the temporary problem, but it creates its own avenues that needs to be explored, and it needs to be regulated. But at the end of the day, especially for medicine, a greater validation, monitoring, transparency, and supervision, supervisory reviews, better to say, would be the great anticipation that we can have for these chatbots.
What do you say to people who are frightened by all of this? Because it can be pretty scary when you think about it.
Yes, but I would say that one day we had cars to help us move faster, commute faster compared to the previous setting. Now, after we have faster commute, after having cars, now we are moving faster, but it creates its own risks. And at the end of the day, we can think better to use better the tools that we have in hand. And I would say AI is exactly the same trend, and we should always keep an open eye and be cautious about how we are using AI and why we are using AI.
Well, Dr. Rodd, lots to think about. I appreciate you making time to tell us about this.
Thank you. I appreciate that you spent time and asking these nice questions.
My guest has been Dr. Bardia Rodd. He's an associate professor of pathology at Upstate and also the associate director of AI innovation at the SUNY Upstate AHEAD Center. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.